So bedside shift report's another evidence-based practice that improves patient safety. So a lot of the things that we talk about with rounding by nursing staff, we tend to think about the patient experience or patient satisfaction. I would encourage our nursing staff to look at bedside shift report as the best nursing practice to improve communication. One of the things that we do know is that when we include patients and families in their care, and that includes patient handoff of patients, that we have better outcomes and we have better engagement by the patient's family. Doing bedside shift report at the bedside, not outside the door, not at the nurse's station, but in the patient's room where you can visualize the patient. You can pull up various things you may need to share with one another on the computer. You can actually look at the patient's IV site, wounds. You can even use that as an opportunity to reinforce, teach back, or identify patient education or family education needs, and you can help set goals with the patient. Bottom line is, bedside shift report demonstrates for patients and family and for us that we're in it together, that we know what we're doing and we're communicating about you and we're including you in this communication. A lot of times nurses have concerns about sensitive information. I would always encourage nurses to critically think about that communication. If there's something that you're uncomfortable communicating in front of a patient or in front of the patient's family, then you definitely need to have a little bit of a conversation before you ever go in the patient's room. But bottom line is, it's a evidence-based practice that improves patient experience, actually improves patient safety, and improves the nurse's experience as well.
Come in.
Good morning, Mr. Smith. I'm back again.
Hey, Mr. Smith, my name's Pam, and this is my RNT, Sarah. We're going to be nurses this morning, so you get two for the price of one. So we'll be doing bedside rounding in just a moment. Oh, hey, good morning.
Hi, good morning.
Are you related to Mr. Smith?
I'm his sister. My name is Janet.
Oh, okay. Very nice to meet you, Janet.
Nice to meet you too.
We're going to be doing bedside rounding, so we do take the time to invite guests to step out for a moment so that we can discuss patient information.
Okay.
That's my sister. She usually makes a lot of health decisions with me, so I'd like her to stay.
There's a couple of components to bedside shift reporting. One is that you get the patient involved. And so this is part of the patient's plan of care. And we want to make sure that they understand what's happening. And so that allows the nurse, the people that's taking care of them, and the patient to understand what the plan is. The other piece of that is that communication. We all know in nursing, from shift to shift, you have a communication gap at times. This allows both nurses to know what exactly is happening with that patient, so that communication is key, and that's what saves lives when you have that communication from shift to shift. So that's the two most important things with bedside shift reporting, and I see it work all the time. So I think it's a great thing for us to do.
I have Mr. John Smith. He's a 40-year-old male, came in for a motor vehicle accident. He also has a chest contusion and a fractured ulna. He is a full code. He was admitted to Dr. Stevenson. He's got a history of diabetes, hypertension, and high cholesterol. He's NPO because the orthosurgeon is consulted, Dr. Brown.
What does NPO mean?
Nothing by mouth. Nothing to drink or eat.
Okay.
He does have an
So
allergy.
you can't bring me anything?
Okay. Not yet.
Not yet. Not until the surgeon sees you.
Okay.
He does have an allergy to penicillin. He's got a 20 gauge to the right upper arm where he's got normal saline going at 75 milliliters an hour. He's on 2 liters nasal cannula where he's at 97%. He's been running sinus rhythm in the 90s. Yes, he does have a splint to the right forearm. Because of his history of diabetes, he was Accuchecks ACNHS. The last blood glucose was 86. His last pain medication was at 5 a.m. He is a full code, level 3 fall risk. That alarm is activated because of everything he has going on.
Yeah, that's annoying when I move. Why do I have a bed alarm on?
You have all this IV fluids, and then from the motor vehicle accident, you've developed some weakness, so we've had to restrict you.
It's
so you
for
do
your
not
safety.
fall. It's for your safety.
We have like a grading scale based upon different criteria, and in order to keep you safe, we grade that, and you fall within that area because of your IV fluids, because we wouldn't want you to trip over it or anything, but we want to be there in case you need it.
I'll play along.
Okay, sounds good. Now, how is your pain level going?
Yeah, I'm okay. I'm okay.
So if we had to rate it between 1 and 10, 1's low, 10's high, what number would you give it?
I would say it's about a 6.
Well, I think I want you to be a lot more comfortable than that.
Yes.
So we're gonna see what you can have and we'll bring you something. If not, we'll call the doctor.
Our pain goal for you is definitely a 2, so
Yeah, we talked about that
we
earlier.
want to do whatever we can.
And let's go ahead and prop your arm up and that'll help to kind of keep you a little bit more comfortable and cut down on the swelling. Is that
That
feel
does
a
feel a
little
lot
bit better?
better.
Okay, great. Do that. So we've addressed your pain and if any time you have any questions, please feel free to ask anything. Okay. Now we talked about your NPO status and that is basically you're going possibly to surgery. So in order for you to be ready for that, we can't let you have anything to eat or drink, but we're going to be monitoring your sugar 24/7.
Do I have anything else to do today other than that surgery?
Yes,
Yeah,
Ms.
sure.
Natasha.
Okay, it looks like you have a CT scan ordered for 8 a.m. this morning, and it looks like they will be drawing routine labs within the next 30 minutes. It'll be a CBC and a BMP, so just check for your electrolytes, your white blood cell count, make sure there's no infection going
So
on.
be expecting lab to come in. Yeah, so we like to keep you abreast of everything. Now, I just wanted to show you and my orientee, we do have a board here. Can you see it? Can you see that okay?
Yes,
This
I
is
can
your
see it.
patient board. It has your current nurse on it and the charge nurse, which last night was Margaret. Today, the charge nurse will be Troy. We will put our names on that board. We have the date and we have your NPO status and your pain level goal on that. And we do have some goals for you today, which is to keep you very comfortable, okay? For that pain goal of at least a 2.
Well, that's
Hopefully we can get
important.
better. That, and then we're also going to be getting you up in the chair, because the more you move, the better you're going to feel, okay? So if you, like I said, if you need anything, don't hesitate to call us if you have to call, right?
Yes.
Which is here, okay? That in the red is for the nurse.
Yes.
So that'll be it. So it comes directly to our phone. So call us if you need anything, especially if you need to get up, because we have a lot of lines and things, and we want to make you safe walking to the bathroom. We're going to be collecting.
So my sister can't walk me to the bathroom?
No, it'd be better because she may not be familiar with this equipment, and it's a little easier because we deal with it every day.
And we don't
But-
want her to get harmed either if you do happen to fall. We are trained in those type of situations.
Okay.
So we do have a urinal on the side because we keep track of everything that goes in and goes out. Let me bring your table a little bit closer. We do have a folder here, and everyone who comes in to educate you on anything from diet, whatsoever, movement, physical therapy, is going to put some information in here, and you can read it at your leisure, and it'll be going home with you, so you'll have some reference when you go home.
Okay.
So that'll be here. And then we have an incentive barometer. We're going to come back in a few minutes and go over that with you. Just a little health hygiene, since you may not be taking as deep a breath at this time, just because of your injuries and stuff. Do you have any other questions that we can help you with?
You did say he was on a regular diet.
He's NPO
Oh,
for
that's
right
right,
now.
okay.
And because he is diabetic, he's going to be on 1808, which is an American Diabetic Association diet, because we're watching those calories and stuff, and we will be monitoring his blood sugar before all meals. So even though you're not eating, we're going to be making sure your sugar doesn't go low. Okay? But we'll let you know as soon as you do get to eat.
Okay.
Okay? But like I said, anything you need, just don't hesitate to call me for it.
Thank
I'll be
you.
heading out for the day. Is there anything that I could have done for you in the last 12 hours?
You do a good job.
Oh, thank you. All right, well, I will see you again tonight.
I'll see you.
Okay. Well, thank y'all. We will be rounding every hour, Mr. Smith, so someone will be here, if you need any help. with
Well, I
it.
think I'm about to probably take a nap if I can, just for a second, because y'all said you're about to start getting me up and stuff.
Well, you go ahead and take a nap, and if we come in, we're gonna be checking your lines and everything else and making sure that you're doing okay and your vital signs. But you don't have to wake up, we're not gonna wake you up, we're gonna let you rest, okay? All right, but we will check you.
Your head back?
Yes, thank you.
Tell me when.
That's good.
Well, it's nice to meet you.
Nice meeting you too.
Just turn the
Thank
lights off when
you.
you leave.
Hope you have a good day.
There's a lot of activity going on, a lot of distractions going on at shift change, and we want to put the focus back on the patient, and that's probably the easiest and safest way to do it, is to actually be there in person in front of the patient, and that way we can address patient issues right there. The patient doesn't have to wait for us to get out a report. If there's a safety issue, we can address it right then and there. So I think bedside reporting is crucial, especially on with the patient population today being so sick and having so many comorbidities, and it's just a great way to learn about your patient at the start of shift and then address safety issues.